Thank you. Prynawn da and welcome to this meeting of the Social Services Scrutiny Committee. It'll be the last one, obviously, of 2020. Please note that this meeting may be recorded and broadcast via the authority's internet, and the images and sound recordings may be used for training purposes. If we can move then to the agenda. The first item is apologies. Have we received any?
We've got apologies from the board member
and Councillor Julia Jenkins.
Okay. Thank you. And any declarations of interest? Okay. As there's no declarations, we can move on then to item number 3, which is the adoption report. And I think Joanna is going to take a lead on this, and then Angela, our colleague from the Vale, will be available for any questions that members may wish to ask.
Okay, thank you. So this is the annual report on adoption services covering the Vale, Valleys and Cardiff Adoption Collaborative. So that's available at Glamorgan, Merthyr Tydfil, Cardiff Council and Rhondda and Taff. The report covers from the 1st of April 23 to the 31st of March 24. This is a requirement under the Regulation 39 of the Local Authority Adoption Services Regulations. So, which we have to report on a 6-monthly basis, and that's been incorporated into the report. It also covers the reporting requirements set out in the governance arrangements for the region. So it looks at performance, the activity, the quality of the service during that period. So that finished in April of March 2024. So the purpose of the report is for Scrutiny committee members to note and debate the contents of this adoption report and to consider it. So as said, so Angela is on the screen and can answer any questions that may be directed at her.
Thank you, Joe. Angela, is there anything you want to add to what Joe has said at this stage, or just move into questions?
No, I mean, I think the report, as Joe said, it is a report of last year. We are required by our collaborative agreement to also report to Scrutiny. So I think this is actually our 9th report, because we're actually going into our 10 years now. We've been running 10 years. I think the report follows a sort of similar format that members would be familiar with. I mean, obviously, a key area is the emphasis on performance. We are required to report to the National Adoption Service on a quarterly basis on the range of performance indicators, and those have increased year on year, really. So we've now got a sort of wealth of data and information about adoption activity, really. So it's and I think so the report goes into detail explaining all those service areas, and then the appendices give more of a breakdown of the data and a range of factors and comparative data over a 3-year period. Obviously, it gives figures for a range of activities in terms of Merthyr as opposed to the wider region. But I think, yeah, so I think it's quite a lot of information there, really. I think in terms of the governance, I mean, during the year, obviously we fully complied with the requirements. One of the big areas that we had to consider at the latter part of the year was the cost savings for the collaborative this year, which were agreed by joint committee in February. So we've had a 5% savings that we've had to find for this coming year, but that was agreed during this reporting period. And the direct transfer of the chair of the management board transferred to the director of Merthyr Tydfil last autumn, and that's on a 2-year cycle, the chairing of that meeting. So the report, provides a lot of rich information, and I think sort of overall the year-end performance was healthy. Challenges in terms of the numbers, increasing numbers of children being referred, adopter recruitment is showing indications of it declining a little. and we've done quite a lot of work around trying to drive up adopter recruitment across the region and also within the Merthyr area. So that is a challenge in terms of being able to meet all the needs. And the other area is the big growth in adoption support and the demand for adoption support services, which is placing a strain on regional resources. So those are just some sort of headlines, really. I don't know if, I'm obviously happy to answer questions or cover more aspects of the report if you wish me to.
Thank you, Angela. We'll pass on to members now for any questions first of all, and we move on to comments afterwards. Any questions, please, from members? Councillor Covey?
Yes, I was wondering now, there was a little comment about it in the report. What's the position now if people want to contact the birth parents?
Yeah, there's been quite an emphasis on wherever possible direct contact, or certainly a much greater emphasis on contact arrangements post-adoption. So that arrangement would be put in place prior to the adoption order taking place, so the adopters would know and the birth family would know. So we have seen a slight increase. There's much more emphasis on it. It's an area now we have to report on, because we have to report on a quarterly basis for all the contact arrangements are made. So it's direct, indirect. Some have a mixture of contact and indirect. Former foster carers, they're very much part of a child's life post-adoption, and we have a small number of cases where there are sibling contact, ongoing sibling contact, and some birth parent. So it is an increasing area, definitely. And again, that can pose some challenges in getting the right sort of adoptive families who are prepared to take on that for the child's life.
If I could ask one follow-up question. If someone was adopted, say, 40 years ago, and there was no arrangement put in place at the time, but they wanted to contact the birth parents, what would be the legal position?
We undertake that work. It's called access to birth records. So we actually provide that. What the legislation says is that we're supposed to provide some counselling to those persons. And we then would do the searching. We'd apply for the court records, do the searching, and obviously if both parties were minded to, put those parties in touch. If obviously they're still, if the birth family is still alive, etc. So yes, so that's a growth area for us too, is the access to birth records, and the St David's adoption agency, which is a voluntary adoption agency, has actually got now a pilot service that is focused on what they call the pre-1975 adoptions. So those are the adoptions 40 odd years ago, and we've referred a small number to that service. So yeah, so there's I don't know if you're probably aware, but Welsh Government, along with the British Government, gave an apology to those largely mothers and adoptees from that period.
Yeah.
And so this service has arisen out of that, really. There was some funding put aside for it. But no, we would undertake the searching and, if possible, put parties in touch.
Oh, thanks.
Thank you, Angela. Councillor Jones, Claire Jones? Oh, we didn't think so.
Put his hand down, he doesn't have to, does it? Whichever.
Okay, go on. Yeah. Ladies first.
So, wasn't prepared then. I'm so sorry. I gotta scroll back to where I was started. May have to go back the other way. I do apologise, because this makes me look so incompetent. I was going to ask a question. There we are. What's this one? So mine, I was looking at 5 and 5.1. So we're saying about the unusual increase in placement breakdowns prior to the adoption order.
Yeah.
4 placements, a total 6 children have disrupted during 23-24. So when we say in a placement breakdown, are we saying that the child has been completely removed from the adoptive parents and is unfortunately back on for adoption, or are we saying that the child is there's therapeutic mediation going on between the parent and the child? I don't understand what that's looking like at the minute. Please.
Yeah, I mean, it was quite unusual for us really, because prior to this year we'd had a very low rate of placement breakdowns. So these are all children prior to the adoption order taking place. So so the situation, obviously those children varies, and some would you know, I think most of those children have gone on to further adopted placements, and sometimes they would require therapeutic input. But yeah, so these are all placements for whatever reason, you know, that are broken down prior to the making of an adoption order. So it's quite it was quite an unusual set of circumstances for us. We are, when a placement breaks down, we have what we call a disruption meeting, which actually brings together all the personnel involved with that child, and looks at the reasons why the placement broke down, any background features, position of the adoptive parents, etc. So that is all sort of analysed, and if needed, then you know, therapeutic input would be put in place, really, to obviously to minimise the effect of that disruption on the children. But yeah, so there's a range of, you know, it's not just, they don't automatically, in most of those cases they've gone on to be adopted, you know, to further placements.
Thank you, Chair. I've got a second question. So I'm looking at 7.10, and it states obviously that with the adoption we've had 2 in
Yes.
So when we say 40, a total of 40 households,
Yes.
is that in this area, the 40? And
40, the whole of the region.
the whole of the region?
Yeah, I mean, sorry.
No, that's fine.
Yeah.
We've only had 2 in
Yeah.
at present.
I think it's a concern for us. As I said, I think I just highlighted is that certainly adopter recruitment is going down. It is quite a national issue, so it's not just peculiar to our region. But yeah, the overall number that are approved was 40 for the region, and 2 of those were for Merthyr. We've done quite a bit of work trying to you know, target Merthyr, and I mean, RCT only actually had 7 last year, which is unusual. It's a big area. But so we actually at the end of this period, we actually advertised as part of the council tax inserts. So there was information about our service that went out to all the council tax, because we very much want to sort of drive up adopter recruitment in you know, the Merthyr in particular, because obviously you know, that Merthyr can actually provide placements for children within and vice versa within the region. So yeah, so it is an area of you know, that we would like to drive up sort of adopter recruitment, and we're always looking for different ideas or initiatives to try and attract you know, prospective adopters, really. So as I said, we did the council tax inserts last year as one method. You know, obviously it raises the profile of adoption, makes people aware, you know, the service exists. But I think we are seeing a, you know, there is a national reduction, and there was some work commissioned at the end of this period to look at conversion rates. So to look at trying to look at the reasons why you have such a large number of inquiries, and then there's a small number that actually go on to convert into being actually approved adopters. So it is something that NAS have picked up. So there's been some work undertaken at a national level to try and understand those the reasons, the factors that and obviously we've got general things like the cost of living, etc., which all sort of can impact. But yeah, I think we need to understand more about that and try and drive up adopter recruitment in the areas of the region where it is low, really.
Thank you
So
so much.
if there are any other suggestions, we're obviously open to different mechanisms for trying to attract adopters, particularly in Mercer.
Yeah, and so yeah, like I was just going to say, thank you so much, Angela, because you've covered some of the other questions that I was going to ask you.
Thank you.
And thank you, Chair.
Thank you, Claire. I think she asked with me as well. So, Councillor Ian Thomas.
Thank you, Chair. Angela,
Yeah.
page 19, 4.8, 11% of adoptions were placed outside Wales. I wondered what would be the reasons for placing adoptions outside Wales?
Sorry, 4.8.
4.8.
Yeah. Okay. Yeah. Yeah. I mean, the reasons. Again, this is something that is an area that's been monitored quite closely, and actually we did well during this period because 82% of our placements were all placed within the region. The factors that usually require us to go further afield are ethnicity, complexity of the child's needs. So if we don't have a placement to meet that child's needs, then all children are referred to a national register where there's a sort of matching and linking process. So we are required to refer all children to this national register. But yeah, so it's usually to do with complexity, ethnicity, and sometimes joining siblings. If a sibling had been previously adopted outside the area, then we would seek to place the younger sibling with that child. So those are the factors that tend to and sibling groups we're finding too, because we've seen an increase in the number of sibling groups requiring placements. So again, if we don't have a suitable placement for that particular sibling group, then we would be seeking further afield. Obviously the local authority, as the agency responsible for the child's placement, and the child has to agree to an external placement. So there's a process that has to be undertaken. But those are the sorts of factors that we encounter that sometimes require us to go further afield.
Oh, thank you. As a matter of interest, what exactly is pay-per-click advertising?
Oh, how it's a mechanism. I'm not very up on these, but it's a mechanism that you can do via sort of Facebook and that type of. It's pay. I don't fully understand it myself, to be honest. Sorry. But it's a form of sort of digital advertising where people click on to indicate their interest in adoption. So yeah, so that's what it is.
All right, thank you.
We try all sorts of obviously it's a secure process, but you try all sorts of. You pay so much sort of advertising through Facebook and those means, and then it's pay per click. You pay for so many clicks that somebody that people make out of interest, really, in terms of adoption. But I don't fully understand the mechanism myself. My apologies for that.
Right, okay, no, that's fine. I've just got a
Yes, it's
couple of
something our
comments.
marketing officer leads on, because we've got our own discrete marketing officer who actually leads on that.
Right,
We're
okay.
still on questions, Councillor Thomas, at the moment. We're still
Pardon?
on questions.
Sorry, Gareth?
We're still on questions.
Oh, beg your pardon. Right. Well, I've only got comments left now, so I'll wait until I'm called.
Thank you.
Reporter will understand. Click.
Yeah, I'm sure there's somebody in the room may understand it. That's more than me.
Are there any other questions from members before we move to comments? I've got a couple. Okay.
Yeah.
It's in relation to the council report. I think in paragraph 3.1, there's reference to 6 monthly and 12 monthly 6 monthly reports. Do you mean in addition to the annual report, or I wasn't
Yes.
clear what I was referring to?
Do you want me to answer that, or?
Either of you is okay.
Okay, yeah. Under the regulations, we're required to report on a 6 monthly basis in respect of our quality of care. So we have to do that. It's called a quality of care report, and that satisfies our regulatory requirement. But in addition, as part of the collaborative agreement that was set up when we were established in 2015 and was revised last year, we are required to provide an annual report. So what happens is a lot of the quality of care materials and etc. that produced actually contributes to the annual report. So we've got we're required, but us internally, to report on a 6 monthly basis, and then we report to the 4 partners an annual report. But a lot of the information is utilised for the annual report.
Thanks, Angela.
Okay.
I've got a further one regarding the numbers of children you say with complex needs.
Yeah.
Obviously, what effect does that have on the resources that are available to you?
Yeah.
Obviously, I'm assuming it stretches resources, etc.
Well, it does, because what we've found is that, you know, those, all those, you know, obviously what we're finding the increased complexity when we're trying to secure a placement. But what happens then is that those children, when they go on to be adopted, those needs can sometimes become more apparent. So they will then require an adoption support service. So that family will require a support service. So what we've found is that year on year, we're having increased numbers of referrals for adoption support. And we've got a very small team that supports that area of work. And also, when those children, if they go on to needing ongoing support, sometimes they need quite expensive, what we call a therapeutic package. So they may need additional support from psychology, or or some sort of behavioural support, etc. It can be a range of range of factors that require that support, but it is placing a strain on resources, because there's some insufficient resources to meet all those needs.
I think my final question is in relation to inquiries being made, but not they are not seen through to become adopters.
Yeah, that's what. Yeah.
Are they're dropping out? It's not the adoption panel that are turning potentials down. They are dropping out. Am I correct in saying they just dropping out themselves?
Because what happens is somebody makes an inquiry, we provide them with an information pack. Then if they want to proceed further, we then have an information evening where they're invited to get more fuller information. And then if they want to then pursue their interest, we undertake an initial visit. And then if they want to proceed further, we then put them on a 3-day training course. And then if they then want to continue, that's when the assessment process starts. So that's why we're seeing, you know, we get a lot of inquiries, but then a dropout along the way, and that's why we need to understand the reasons for that. Really, what are the factors that are preventing those people having made the initial inquiry and sometimes gone through the initial stages, why they don't want to proceed further. But yes, so it is quite a. It's not, you know, and it's, and even the ones that don't start the process, we actually follow up on inquiries. We follow up after a month, and we follow up at the 3-month period to see if they're still interested. So there's a lot of work being put in to try and, you know, capture as many applicants really as possible. So then the adoption panel is some way off. You know, we are required by law now, by regulation, to try and approve adopters within 6 months. So there's a 2-month period where they have training and we do the checks, and then a 3-month period, a 4-month period when we're supposed to do the report for the panel, the assessment per panel. So it's quite a process, and it's quite tight. But yeah, we are concerned about the, you know, the overall reduction, you know, what we see as a reduction, and that's continued really into this year. And obviously that then does pose challenges for being able to place children quickly. And, you know, it could, in some instances, mean that we have to rely more on external placements, which isn't right really for children.
Thanks, Andrew. I thought that was my last question, but I've got another one. It's in relation to staffing.
Yeah.
Reference to staff turnover in the report.
Yeah.
3.1. Has that had any major effect on the service?
Not really. I mean, I think we've overall, we're a fairly stable staff group. We did see some turnover towards the end of this reporting period. I think, you know, people make a conscious choice to want to work in adoption. So overall, we have a you know, as I said, a fairly stable. As I said, there was some turnover. And what we've actually now been able to, you know, do is, with the turnover of staff towards the end of this reporting period, we've been able to look at the service and use some of that vacancy position to actually contribute to our savings, the 5% savings that we've had to find during this financial year. So yeah, but obviously we you know, we don't want, you know, at the moment the staffing is stable and we don't have any vacancies. So yeah, that was unusual actually, that towards that, you know, to have that all at one time really.
Thanks, Angela. That's the question. Ian, have you got your hand up? Is that for a question or for a comment?
No, I've just got a couple of comments now, Chair.
Okay, we'll move on to comments then, and Councillor Thomas has got his hand up. Okay.
Sorry, you calling me?
Yes, please.
Thank you, Chair. Well, I was just going to say on page 529 that you've had a successful internal audit report, and I'd like to say very well done on that.
Thank you.
211 on the same page. I'm noting your comments on the increasing pressure on reporting requirements, and I do hope that you're able to get sufficient extra resources to deal with it. And the other comment I've got is on your statistical report in its entirety. I'd just like to say congratulations on the quality of that report.
Yeah.
It must have been very painstaking. It's a very comprehensive report, interspersed with interesting comments and explanations. I was very impressed with it. So let's just like to say congratulations on that report.
Thank you. Thank you very much.
Any other comments? Councillor Jones? Claire Jones?
but also for you constructing an exceptionally good report, regardless. With the, you know, some of it is a downside with it, with some of the adoptions and things, but I think all in all, you know, you've put together a really a good report. What I will say to you is, if you think there is any way that we are able to assist you with looking at promoting the adoption, please let us know, you know, because
Thank
if
you.
there is something we are able to do as councillors, then I am more than willing to say to you, by all means ask.
Thank you. That's very, very helpful. Thank you.
Well done, and thank you, Chair.
Any other comments? Just for myself, really, thank you, Angela and Joanne, for the reports this afternoon. And I echo what the comments made by my colleagues here. And to have a compliment from Councillor Thomas on the stats, etc., is a compliment. He's pretty hot on things like that. So thank you all very much.
Thank you very much. Thank
Have a
you.
nice Christmas, Angela. Thank you.
You. Yeah, thank you very much. Good night.
You need to stay if you don't want to.
No, it's okay. Thank you very much.
Thank you.
Bye-bye. Bye.
Right, if we'll move on then to the next item, which is the Flying Start report. And I think Sarah's going to give the report, is it? Yeah. Okay, thank you, Sarah.
To Flying Start expansion, and in particular the take-up of childcare. So in summary, the expansion of the Flying Start programme has seen some really encouraging progress, with the cap number that was given to us by Welsh Government being achieved, and some positive take-up and attendance rates across the childcare entitlement. So future focus will be on continually improving on the take-up of childcare, and in particular in the expansion areas, and continue to work with parents and providers to encourage good attendance at the childcare entitlement. Alongside this, we're planning for a final expansion phase should funding become available from the Welsh Government. So the report also evidences the challenges that the programme faces, including in relation to the escalating needs of children, and the pressures that this places on the programme, and in particular on childcare settings. Whilst implementing systems to ensure effective intervention during the antenatal period and early in a child's life due to the long-term benefits of that, and that is going to continue to be a focus of our work going forward. Thank you, Chair.
Thank you, Sarah. Any questions, please? Councillor Tuvey?
Oh, I'm right. Now, I noticed that the Flying Start can be available to people living outside the Flying Start area. How do they assess which children can go to Flying Start if they're not in a Flying Start? Is it like an ad hoc procedure, or is it like a formalised procedure?
So it's on a needs-led basis. So those who are not living in the geographical targeted areas. So we have set up a multi-agency panel made up of health colleagues, social services, prevention colleagues, etc. And it's needs-led based on the health-based assessments. So health visitors who work with all families under 4, they undertake a number of assessments, including the Welsh levels of care, the look at needs within families, and also the freight, which looks at the resilience within families. And there's also another assessment called the SOGS. So we sit these assessments side by side along with the information that comes through from the health visitors, and the panel will look at that and look at the needs of the family and look at how they could potentially benefit from coming into the Flying Start programme, and what support that can offer them, and the decisions made on that basis.
Oh, it's quite well organised then, really.
Yeah.
Yes. Oh, thanks. That's a...
Can I just add to that, Clive? Because the element of that as well is that through that outreach programme, which is an element within the Flying Start programme, means that they don't just get access to childcare then, they can get access to the other interventions as part of because there's a recognition there's some wider needs in the family, so they can get access to the speech and language support, they can get access to the parenting support, which they wouldn't get access to through the expansion programs, which is only childcare. So after the phase 2 expansion that happened, that was childcare only, and any potential phase 3 would also be childcare only. So we'd continue to look at that outreach approach and targeting the families with a higher level of needs into all 4 aspects, if you like, of the Flying Start programme.
Oh, thanks.
Councillor Claire Jones.
I'm particularly looking at cross-border, so 514 and 515. You know, it states that we have one child who's currently being funded in a provision in RCT, and why, you know, if there's only one, how many other children potentially are missing out on getting funding for the provision that we can't accommodate them for within RCT? So that's my first question. So you've got one child who's in a provision in RCT, so why is there only one? So is that one child, is there a specific reason why they have been granted funding, or are there other families who realistically should be able to get the funding to be able to also have the same provision in RCT? Thank you.
Yeah, thanks, Claire. The element of reason there's only one child in there is because RCT have reported to us they've only had one application for a child coming across to RCT, whereas if you look at 5.15, there are a number of children who are actually in Caerphilly, who in a provision just across the border, which currently we can't get an agreement on with Caerphilly for the cross-border working arrangements, regardless of the fact that it's in line with Welsh Government guidance. But the question is, we've only had one that RCT have notified us of, and they've agreed the same protocol as we have and are happy to fund it and structure the support in the same way, which is the organisation that's hosting, so that RCT would comply with all of RCT's way of doing things and RCT's policies, and we would just reimburse the money to RCT based upon the cross-border agreement. But we are aware of that number coming from the south of the valley, going across the border into the Caerphilly borough, that we can't get that agreement on at the moment. So it's a challenge.
Children going into Lewis at the moment, so the parents are paying out of their own pockets for them to be able to go to the facility in the Caerphilly region then. Okay, thank you, Chair. Oh, sorry, one more. Oh no, is a comment, you're all right? Sorry, Chair.
Councillor Ian Thomas.
Thank you, Chair. Is a basic thing. This service is based on postcode. Now, it's meant to attract the families that need the service, but is it too blunt an instrument to go by postcode? Because postcodes include well-off families, medium and poor families, and it's not. I don't see how it's fair. To exclude some and include others. So what I'm asking really is, do you agree that it's unfair? And is it at all possible that the system can be changed as it develops to a different basis, not just based on postcode?
I'll pick up on that, Councillor Thomas. I think the element is, obviously, it's a historical system that's been in place now for many years in terms of Flying Start and the way Welsh Government have instructed the rollout. What it will mean, though, is that probably the most popular part of the programme, childcare, we are currently at around 80% of the coverage across the county borough, even having access to that free childcare element. But we are currently prepping a document for Welsh Government about what it would cost to roll out the childcare so that there would be 100% coverage. And we're waiting for Welsh Government then to come back and identify whether there is the funding to do that. And every local authority has been asked to do the same in that respect. And that's what I think in terms of the programme in its entirety, all 4 elements, because we haven't been given the funding to roll out all 4 elements, we would continue to work with the health visitors around the outreach model to try and target the additional elements, which would be the enhanced health visiting, the midwife, get the right word, midwife, and the speech and language and the parenting support at those families who need it the most through an assessment, so that it's not an ad hoc basis. But we will have, hopefully, by in the near future, 100% coverage of actual childcare available to everybody. Because I think everybody, even the Welsh Government, recognise the postcode system represents some challenges and some concerns.
Well, thank you very much, Chris.
That's
all. Thank you, Chair.
Thank you, Chair, for allowing me to come back in. I was looking, I missed the question, I do apologise. It was the children with emerging additional needs, so I'm looking at 518. And on the table, you have obviously, it's saying that the number of children for 23-24 was 111, with only 82 of them being awarded the additional support. So my question is, what happened to the 29th? You know, if they're going to need support, then surely I'd like to think that there would be something in place. And is there going to be something in place? Because obviously, if they haven't got the support now with flying starts, my concern is then going into school, they're not going to be used to that setting and the help and assistance that is going to be there. So, yeah, thank you. Thank you, Chair.
Thank you for that question. Yeah, so there's 111 referrals that have come in through to the panel with a suggested need. And the panel look at those needs, and they've got the relevant specialists around the table who will be aware of those children and will know those children. So it's the 82 have received the actual support, but it's not to say that those other children haven't received a level of support. So we operate a graduated response within our early years settings that looks at providing universal provision, which is what every child in the setting would get, moving on to an enhanced, a targeted and a specialist. So it may be that the remainder of those children are receiving an enhanced or a targeted provision, but that might be through being able to offer that already within the capacity of the setting without needing to bring in extra adult support to be able to do that. So we've invested quite a lot of money in training our practitioners to be able to offer certain interventions and packages of support without needing to bring in extra adults to be able to do that. So, and we've got eyes on those children. So they're known to panel, we're observing their progress that is being made, that's being monitored through an individual play plan. But that's not to say that at that point in time they're receiving additional adult support, because their needs are being met without it at this stage.
Good answer, and thank you very much, Chair, for allowing me to speak again, so thank you.
No problem at all, Claire.
Can I just add on to that? And I just think it's important as well, is because what we've been very conscious of within early years is we've got to try and get in early to meet those emerging needs, but we've also got to balance that off against creating a demand for one-to-one support that rolls on right throughout education. So we're getting in early, we're trying to get that element in, but we're also monitoring that every 6-12 weeks in order to understand at what points we should scale that back, in order that we don't just create a wave of demand where parents think every child should have one-to-one enhanced support, because that would cause a problem right through the system. So that's where it is a finely balanced system at this moment in time.
Obviously, you know how I feel as if I'm passionate about the toileting as well, and I didn't want to bring it up in this current scrutiny meeting, but I think it does sort of tie in, because when we were there and they were going, oh, it doesn't tie in. Yes, it does, and especially it's pertinent to the flying starts. So, you know, I sort of welcome any debate on this, and I think it's very interesting, and for us to sort of try and find that compromise with you as well for the assistance. So, wonderful. Yeah. Thank you, Chair.
Okay, I've got a few questions for the panel here. Am I correct in saying that as a result of the latest two phases, childcare cover has increased to 80%? It's doubled in effect as a result of the two expansions. Okay, that was my first one.
Yes, Chair, it would be around 80% now, and it's the highest in Wales in terms of, if you look at each local authority, we've got more coverage than anybody, and it's why during the year Welsh Government asked us to do a piece of work to cost out what it would be to get to 100%. That wasn't affordable to Welsh Government at the time. Obviously, the budget positions are being worked through at the moment with Welsh Government, but that's why they've also now asked for local authorities to put together that information again in order to eventually we can get to 100% as quickly as possible. And I think the aim is they would like to see us get there very quickly.
If we were a better amount, put any money on it? It's based,
maybe come back to you after the budget's through.
Based on previous expansions, though, it's looking quite hopeful.
Sarah will probably be able to tell you more. Yes, I would be hopeful, but what we've got to make sure of as a local authority is that we've got enough childcare spaces that we don't then end up saying 100% of people are entitled, but by the way, no, you can't have your space because there's not enough childcare provision out there. So it really is reliant upon having the childcare provider spaces available as well, both in English and Welsh.
A follow-up then on the 80% of Merthyr having one of the highest childcare provision in Wales. Well, it is the highest. What is the reason for that then? That we are so much higher than quite a number of other authorities.
I mean, I'll pick up one. A number of years ago, there was a commitment made to get to a certain percentage, and there was an error in some of the figures that was provided to Welsh Government at the time, which meant they ended up having to commit to us more than they originally thought. So that had to be addressed and readjusted in a budget, and that sort of pushed us further along than before. But also things like the number of children we've got in the borough is probably accelerates a bit quicker here than it does in other places. Sarah, is there anything you want to add to that?
No, I was going to say the average coverage across Wales was about 25% a flying start in other local authorities pre-expansion, and we were always operating about 42%. So we were always that percentage ahead of other local authorities. Hence, when the latest expansion has come, it's made us jump that much higher. So, as the report states, I think once the next phase comes in, we are likely to be the first local authority in Wales that would have that full flying start childcare coverage, which I think would be a great achievement for Merthyr and one to celebrate.
I think my area benefited from the overestimation, didn't it? Coming back to Claire's question on the cross-border, obviously there is an issue down. What is the reason then, if they have signed up to the protocol, why aren't they operating the protocol? Or they've been told they should operate the protocol or sign up to it?
Sarah will come in with some more specifics in a second, but I think the element is Welsh Government have put out this guidance, and I think as we've identified in there, it's a bit more complicated than originally thought of, perhaps, by Welsh Government, and it's had to bring in all the elements around enhanced needs and how that information is shared across local authority borders, how much organisations are paid. There are different rates of what we pay within Merthyr for childcare as opposed to what Caerphilly pay or as opposed to what RCT pay, because there is no national figure around that. So it relies upon the host organisation, which in RCT would be RCT, childcare providers, complying with all of their local requirements. If we went into Caerphilly and said, okay, we're going to pay, that provider of childcare would have to operate two potentially 3 different systems if somebody from Blaenau Gwent was using it. So the original idea from Welsh Government is the host local authority would do all of the work around those children, and then we would just pay whatever they normally pay their childcare providers. And partners have all been part of setting up that protocol, but when it came to the crunch of signing up to it, Caerphilly didn't feel that they could sign up to that. Sarah, do you want to pick up from there?
I think you've probably covered most points. I think discussions with Caerphilly have revolved around data sharing and how we overcome that data sharing, but I'm confident that we've got our information governance team involved and that we can look to overcome that. As Chris says, the additional learning needs. So if we've got a child who's a Merthyr resident, who's attending a provision in Caerphilly, who's potentially got an additional learning need, that becomes a statutory responsibility of us as the residing local authority to address that through our statutory processes through the ALNet. So it becomes a little bit more complicated when we're talking about children with additional learning needs. And as Chris has alluded to, there are additional administrative burdens, which I think probably Caerphilly feel that they may bear the brunt of, because there's a number of children from other local authorities wishing to go to their authority because where they're positioned. So that could place pressure on them. So I'm hopeful that with further negotiations and discussions and potentially involving Welsh Government, that we can look to work through those issues and resolve it, because as Councillor Jones, you've suggested, there are families who are paying for provision that potentially could be paid for them, and that could be more money in the pocket of families, which is something that I think we would all wish for.
My final question is in relation to paragraphs 5, 6 and 5, 7. I think it was about the take-up. There seems to be a lower take-up in phase 2 than there was under phase 1. Any specific reasons for that, please?
So, I mean, I think it's to be expected when there's any new expansion such as this, that we're going to see a potential dip in figures from what we've seen in the original areas by nature of it's a new offer in new communities. What I will say as well is that we've had a change in the application process. So previously it was paper-based with the health visitor completing the childcare application with parents in the home. That's moved to digital now. It's online, so parents can complete that themselves. So I think that's perhaps contributed to the potential lower take-up, but I think that's something that we can overcome in the future. And, you know, as I've said, the new services, and I think the programme previously has been linked to working with families who are most in need. And of course, we're now moving into areas that's not potential, how they consider themselves and wouldn't associate themselves with the Flying Start programme. So there's a whole programme of marketing and communication needed in those communities, and that's well underway. And I can, you know, it's not within the report, but I can say that in our term 1 of this financial year, that those figures have started to increase. So we've already started to see an upturn, which I'm really pleased to report.
Thank you.
Just picking up on one of the points there, Chair. As I said, we've moved to a different way of admitting people into Flying Start because we've got to make it manageable once there's 100% coverage. So we are working closely with the childcare partners, the health service and our own education department around the use of the Capita One database in order that admissions process becomes very similar to the schools process, where it's completed online, it goes directly into Capita, but it could be done by the parent individually, or they could go to a childcare setting, check that there's space available for their child, and then put the application in through the childcare setting. So there'll be multiple ways that can be done in the future in order to both streamline the process and make it as easy for parents as possible. That will just allow us to work with the childcare provider and say, yep, we know you've got space in the setting, that's been done because you've completed that pay, but it'll all be done streamlined through the Capita system directly with the providers as well.
Thanks, Chris. Any comments from members?
Thank you. I would just like to say, first of all, I'm going to look at the complaint because it's only a comment about the complaint, because I think I've said this before in previous scrutinies. I welcome the complaint about the unfairness of the geographic eligibility. I do welcome that, and I agree with it. But I would say that, and I've written this down because families, Flying Start has been beneficial to so many families, giving the child a chance to be nurtured and prepared for a school setting. For some, Flying Start is a childcare provision, but for the child, it's not. For the child, it's the start of their education. And I welcome it, and I look forward to Merthyr Tydfil County Borough Council being one of the first to have the 100% Flying Start, because I think it's awesome. So thank you ever so much, and you know, I just think you are all amazing, and thank you, Chair.
There. Any other comments?
I was just going to say Treveccan was quite a poor area and was the first area to start. But as they're building Sweetwater Park going up, I'm sure Treveccan at one time will no longer be classed as a poor area, you know, simply because they're building a lot of new houses up there, you know. So that's the strange thing about the postcode, really. But I don't think, well, because there'll be 100% coverage, so it won't make much difference, I suppose. But
it was awkward to explain to people. I know I've had it, and Sarah will be aware of it, where there's been new developments in areas which were in, but there were other areas that were still out of Flying Start, and couldn't understand why these other developments were. But that was the areas which had been determined by ONS, I think, wasn't it? Yeah. Thank you for your report, presenting the report. There's no further comments. We move on then to the final report of the committee, the adult learning. Okay, thank you.
Thanks, Chair. I'm going to ask Anthony, for those of you who don't know, Anthony Mee is our new adult community learning manager, where the report references capacity. Anthony is part of the filling of that capacity. So this is the first scrutiny Anthony will have attended. So I'm going to ask Anthony to present the report, and we'll go from there. Thanks, Chair.
Thank you, Chris, and thank you, Chair. This is a report on adult community learning. Summary of the report. The purpose of the report is to update scrutiny members on the status of adult community learning on the Adult Community Learning Partnership, and the refocusing of this for the future to develop a greater shared responsibility across partners in line with the ESTIN recommendations and the statutory requirements. The ongoing challenges and work being undertaken to increase enrolments within the adult learning of Merthyr Tydfil County Borough Council, as the service and others are still feeling the impacts of the pandemic in relation to the learner numbers.
Thank you. Any questions, please? Professor Clive Tubby?
Yes, I was just going to say, is the main part of your job trying to increase enrolment, is it, or is it more coordinating between the different partners?
I think it's a balance of both. I think the coordination of the partnership and bringing the partners together will increase the numbers of enrolments of adults into adult community learning. But as the report highlights, you know, as the manager of community learning, the drive is to increase as many residents of Merthyr Tydfil to engage into adult community learning. So it's trying to balance them both.
Both, oh, right,
Yeah.
You are then. And how many are in the team now? Then this coordinator with you as well, is this?
Yeah, so I'm the community learning manager, so I oversee adult community learning, the Multiply project, the parenting project, and Play. Within the adult community learning team, then there's an adult learning community coordinator, and she oversees 3 members of staff who are out in the community delivering the adult community learning. connotation.
Thanks. Yeah, thanks.
Okay, Claire? Councillor Claire Jones.
Chair. So I've gone on to 4.3 as well, where we have a partner unfortunately withdrawing the funding of a very successful programme. I know it states that due to increasing financial constraints, but if funding had been found, why all of a sudden did you not get enough money to carry on? Because I don't understand that. I do apologise. And my other question on that one is, what happened to the young people that all of a sudden found themselves being just not benefiting from a programme that clearly appears to be doing very well?
Yeah, I'll pick that up, Claire.
Thank you.
The family learning programme originally was delivered by the council through a franchise agreement with the college, and the college, in reducing its funding, in the end decided to remove that franchise agreement, so all of the funding was withdrawn. It was a number of years ago, and what we had to do was slowly close down that project, which was disappointing because, as I mentioned there, it did win an award as well at the Adult Learning Awards, National Learning Awards, and really focused around trying to develop the skills of adults to support their children, particularly around their ability to complete homework, around maths, English, IT, all those type of activities. So yeah, we had to close that programme down. What we've been able to do is, when the Multiply funding was secured, we were be able to start that process off again. Obviously, we've got another problem now in terms of the Multiply funding coming to an end in April 25. But it was down to the college and the ceasing of that franchise agreement at that point in time. So it was a bit beyond our control in that respect.
Okay, thank you, Chris. Can I go to 5.4 with performance and challenges? So I'm looking at the enrolments. Is there, because we've gone from 422 now, we've got 388 with the Adult Learning Wales. Was there any particular reason why that dropped, or is that to do with what you've just discussed?
Adult Learning Wales, no, it's not to do with what I've just discussed in terms of the family learning programmes. If you look at the line, which is Merthyr Tydfil County Borough Council,
yeah,
we went from 166, and in 5.4.1 there you'll see the family learning programme stopped, ESOL delivery by the local authority stopped, because it was identified there were too many players in the marketplace in the previous inspection. So we did work with Adult Learning Wales and the college to streamline that, which has meant the college actually is, you see the numbers in the college have gone up in those 3 years, but ours have gone down, because that's left us delivering maths, English and IT, which are can be challenging to get people involved in. But Adult Learning Wales numbers are so high because they have a wider range of programmes they can offer, but no, family learning programmes wouldn't be involved in that. But I think everybody, and it's mentioned within the report, is everybody's still suffering a little bit from the pandemic elements, and we're still offering provision both online and face-to-face in order to try and increase enrolments back to where they were pre-pandemic, as well as looking at other options in terms of different ways of delivery.
Thank you, Chris. Thank you, Chair.
Okay, Claire? Yeah. Councillor Ian Thomas.
Thank you, Chair. I was just wondering, in terms of promoting the service and attracting more learners in, how much to do in non-digital, in the non-digital arena? For example, do you take out pages in the Contact magazine or put leaflets out? But particularly for the older people, the older learners, they might not be so much into looking it up on online.
Thank you for that question. Yeah, we obviously are building a marketing strategy for the partnership, which will incorporate obviously the online world, but also trying to take into consideration a different way of marketing our programs, which includes making sure that there's leaflets put into community venues, that there's an offer that goes out as part of the partnership to try and encourage as many people from all communities into the services.
Thank you very much.
If I can just add to that as well, Councillor Thomas, I think one of the things we're conscious of is, through the data analysis, looking at the age profiles of who uses the service and how we best target our marketing towards different age groups. And one of the successes we've seen at the moment has been through the use of the Multiply programme. We've been able to get into communities on a more face-to-face level and do far more engagement work and far more low-level, qualification based initially, just to get people's confidence up and get their not their skill level, but get their confidence to a place where they're ready to go on to more academic, if you like, courses, because it's often difficult and challenging to get people to go into maths, English and IT. So we've got to look at how we embed that into other more interesting topics and almost do some of it by stealth. And that's where we're starting to see the benefit at the moment of Multiply, but it's quite resource intensive being out there in communities and engaging on a face-to-face level, which unfortunately the adult community learning budget could not do on its own. So it's that presence in communities as well, and getting people out of their things and engaged in group activity, which has been successful to this point, which, for all intents and purposes, we would love to be able to continue all through next year and beyond.
Thank you very much.
Triara's people together love it here.
Sorry?
Triara's people together love these sessions with Multiply.
Oh, that's all. Thanks, Jeff.
Oh. Okay. Any further questions from members? Okay. I've got a few here. It's in relation to paragraph 4.1 where it mentions a review. Okay. By Eston, I hate to use the word, but is it something like special measures for a school?
Probably not, Chair. The whole way Estin operates now is slightly different, and there's still a category which is follow-up, which just means it's a check-in with Estin just to make sure you're continuing to make progress rather than being put into another category. So we were previously in follow-up with Estin when they first came in. I can't remember which paragraph it is now. In 2020. And we were put into follow-up, and it literally is to say, look, you've had these actions in place, you've told us this is what you're going to do, we just want to make sure that you're actually doing that. And I think that could be helpful in some ways because it keeps everybody on track, and making sure that any improvements are sustainable improvements. But that's also where the sort of inspection process differs slightly from what you would know as the traditional school type measure of that specialised. Yeah, no, absolutely. I understand, and I understand. I think it's a lot of a softer follow up than a special measures that you'd see within schools framework.
Okay, my other question was then on staff turnover, paragraph 4.2. Any specific causes or reasons for that, or there has been mention of maybe sickness there, I think, wasn't it? Yeah.
Yeah, thanks, Chair. I'll pick that one up again. Yeah, we obviously had a previous community learning manager who spent, was excellent in what she did, and the work that she did all around this topic. But we ended up with that individual being on sick for quite some time and leaving the organisation. But the capacity issue didn't just affect us because there was staff turnover within the college as well. But that's. I won't say it's been a benefit, but what we've now got is some fresh individuals who are new to the adult community learning world within the college and obviously here within the authority, and are able to look at things with fresh eyes and actually not be in the old mode of, oh, well, we don't do it that way, or we don't do that, and that's not our job. There actually is quite a refreshing attitude from partners about taking on some responsibility around driving the partnership and being held accountable for specific areas, because that was the challenge really always, about making sure it wasn't just the local authority driving this, that it was shared across the partners. And that capacity challenge has actually turned out to be in some ways beneficial.
My next question is in relation to numbers. Now, you've referred to numbers dropping, I think, possibly pre-pandemic reason has been given, that people don't want to come together to engage. But what I find hard, they simply dropping off from what was the pandemic, because the pandemic was in place in 21, 22, but it seems to be still dropping off. Could you explain that for us, please?
I think there's a combination of factors in the data, and as you we look at Merthyr Councils as the specific one we look at there. Some of those will have enrolled in 2021. Yeah. Some might be in multiple levels of programs, so they might have been in for 1 or 2 years. They might have done a level 1 program, then gone on to a level 2. So there will be some natural tailing off of those learners, but also you've got the elements about programs that ceased to be delivered during also in there. But what we found during the pandemic is, and that's why Multiply has been really beneficial now, is it was a struggle to get people to come back out of their houses and get involved in group activity, particularly where a lot of the learners we were engaging are more mature and therefore had greater fears about the pandemic and what it meant. And it's taken us some time to try to build those back up, along with looking at how we develop a much wider array of programs other than, and I keep coming back to it, I know, but it's, maths and English is not things people automatically jump at and say, I want to learn that. Whereas if we said, look, it is a cookery program, but you get your maths or your English through that, it's a bit more attractive to the community. And Multiply's allowed us to test out some of those theories, if you like, in terms of how we might change stuff going forward.
And fingers crossed, you never know, continue after 25. No.
Funding's been pulled.
Yeah. Obviously, I think you'd agree that some of this, the partnership work, appears to be is very disappointing in this. Obviously, there are signs, as I see it, a meeting in September, that things perhaps are getting more on track with the appointment, perhaps, of members of staff, etc. Would I be correct in saying that, Chris or Anthony?
Yeah, I think it's fair to say we've got a clear vision. There's still lots of work to do with the partnership. And coming into post, that was, one of the big pieces of work was to re-establish the partnership and to get it moving in the right direction. And as you said, Chair, there was a meeting in September, which started looking at how we wanted to structure that partnership and how we felt it was the best way for the partnership to move forward. There's been another meeting since then as well. We've looked at establishing a true partnership where it's equal and it's equal responsibility taken by all partners within that partnership to ensure that it sustains itself moving forward. As the report highlights, we've got a partnership agreement in place which all partners are signing up to, with clear areas for development which partners will lead on within the partnership as well, which is linked into the quality framework for Wales, which has been established for adult community learning across Wales, which will hopefully then drive the partnership in the right direction, in line with achieving the outcomes and working against some of those Estin recommendations and the framework which Estin sets.
If I can just jump in as well, Chair. Yeah, and you're absolutely right. As I say, we've got the college is going to be responsible for the needs assessment across communities. We look at progression pathways in terms of that. We've got Adult Learning Wales that will be responsible for quality. In that, we will take the responsibility for strategic leadership and for marketing and promotion. But these partnership issues are. There's a recent report out by Estin on what they found when looking at adult community learning across Wales, and there are concerns about partnerships and the capacity to deliver them across Wales. So really what's happening in Merthyr reflects what they're finding on a national level as well in that respect. But yes, I'm far more hopeful, and as I mentioned, the fresh faces we've got around the table are taking a greater degree of responsibility over that partnership. And what we're doing that hasn't been done before is we're trying to formalise all of that so that people can't just sort of slowly migrate away from the table without being held to account. Because as I say, the inspection in terms of adult community learning is on the partnership. It's not on the local authority. Yeah. It is on how that partnership operates and what impact that then has on the learning agenda throughout Merthyr.
Thank you. Any further questions before we move on to comments?
Sorry, Chair, I did miss this, and I apologise for interrupting you earlier on. But on page 82, if I address you, Chair, to 82, 5.5.4, I'm sure that would, if you just read, that will give you the other question, because it has has lost the funding effective of April 25. So I was just wondering, has there been any update on that? And have you secured, hopefully, shared prosperity funding to have something carry on? Please. Thank you, Chair.
Yeah, thanks for that, Claire. And it's a really valid, really critical point. Really, it's not valid; it's critical. We've obviously informed all of the partners who deliver in Multiply that the funding has obviously been withdrawn from April 25. We tried to do an exercise with them about, right, let's put individual organisational bits away. What do we see as been really beneficial of Multiply over the last 8 years, because that's what it's been operating, because they're potentially the bits we'd want to keep. We've also met with Alan Owen around what we would see as being needed to be integrated into SPF, particularly some of the elements we've already referred to, that community engagement work, that real frontline facing delivery out in the communities, and that building up that route way through to some of the more qualifications. So we, like everybody else, I think, are waiting to understand what the Shared Prosperity Fund budget is, how the priorities are going to be agreed, supposed by elected members, and are pitching for that Multiply, not the full programme, because obviously we're realistic, you can't have 1.4 million suddenly drop into Shared Prosperity Fund, but what we see as the key priority in terms of that community routeway actually being put into the SPF, and we've made that plea internally. In fact, I chased it today and was told we still don't know what the budget is at this moment in time, but my understanding is there may be a report comes forward at some point about what the priorities will be. I've yet to know clearly if that Multiply request is going to be prioritised in that report. But I have made that plea.
Yeah, thank you very much, Chris, and thank you, Chair, for allowing that.
Any comments, members? Claire?
Sorry, my own voice now. I would just like to say that I do welcome adult learning. I myself found myself in need of adult community learning at the age of 45, I think it was. So, I welcome it, and I just think it's a shame if we lose certain areas. I think adult learning now, you do an impeccable job, because there are young people out there who have gone through their possible school time and they haven't fitted in anywhere and they haven't grown up. And so for you to be able to take on individuals who may have come under the realization that they're not as dim as they think they are, and you know, even adults with any form of disability as well, they can learn as well. And it's great to see that, you know, there's equality there, and you are teaching a lot of people regardless. So I've just got to say thank you ever so much, and I just keep my fingers crossed that you'll be able to get funding and continue the good work that you're doing. So well done, and thank you, Chair.
Thank you, Claire. Any other comments? Okay. What I have got a request of members, possibly the Eston inspection took place a few weeks back. Would members like a report back on the service within the next 6 months? We can discuss it further at on the next item, but that's a suggestion. So Chris and his colleagues aren't. It's not thrown on them really. That we're looking perhaps to have a report within an update report in 6 months, within the next 6 months.
Yeah, that's a good idea.
I'll multiply and we'll be able to update on the Eston inspection.
Okay, thank you.
Thank you.
Thank you.
Thank you.
Okay, and that's the next item then, is the draft forward work programme. Any comments on it? I think we're all familiar with it. There is a gap in April that potentially could be for this. For what we suggested. Members agree? Was it Toby? Yeah. Ian?
Sorry, what are you asking us to agree, Chair?
It's the report which I've asked to be brought back on the adult service. Community
Oh,
learning.
yes, yes, that's a good idea.
See in April.
Yeah, that's fine.
The Eston report should be out by then.
Yeah.
Yeah. Okay. Is there anything else on the forward work report programme? No.
No.
Yeah. Sorry.
Snakes and ladders, because I mean we were unfortunately unable to go to the visit with snakes and ladders. I was just wondering whether we've got anything potentially in place for a visit there, or for snakes and ladders to come in and actually give us a presentation. Thank you, Chair.
Thanks, Claire. Scrutiny referrals, nothing. Report recommendations. Well, obviously we've covered all the recommendations in the report and they've been agreed. I don't think there's any feedback, unless members got anything to feedback.
I would just like to say that I think today's scrutiny has been well discussed, all points are discussed, and I think for individuals to be put on the spot with some of the questions, you know, I think we did have a lot of the questions answered that we needed to. So, you know, I think today was a very good discussion within scrutiny. So thank you everyone for putting it together.
I haven't had anything notified to me under any other business, but if we can, I'm always conscious that we're a small committee. I know we've gone quite a while tonight because we have looked at matters in detail, but we still haven't got any of these of the lay representatives. It's a shame that there's no one like a foster carer or from VAMPT or the voluntary organisation. it's very, very sad to see that, I think, really, isn't it? We haven't got any lay members on the committee. So if we can put feelers out anywhere to try and encourage people to contact you, then, Jane, isn't it?
Yeah.
Okay, so
Well, sorry, Chair, maybe a letter to VAMPT, because they're quite central to everything, aren't they? And they might be able to do something to help.
yeah, that's fine, Ian. Jane will do that, and they are the. But also perhaps I don't know if anyone also through social services, their foster care organisation, groups. They must have got groups, who perhaps could send a representative along.
One time, yeah, Bernard. In fact, VAMPT used to have someone on one of the committees as well at one time.
Well, VAMPT one in the very beginning, Clive, I think, yeah. So that's the meeting is at an end now. I just want to wish you all a very happy Christmas and a New Year. Nadolig Llawen. Have a nice
Indeed. A blwyddyn newydd da.
Da iawn, Ian.
Diolch.
Have a nice Christmas.